My name is Erin Martinez, and my pronouns are she, her, and it's beautiful to be with all of you today. We're going to be talking about a specific type of trauma, which is medical trauma today. A little bit about me before we get started. So I've had the honor of working with the HS community for about a decade, and I've worked with the HS community in terms of education and more specifically therapy. So I'm a mental health therapist, I'm a certified sex therapist, and a trauma-informed therapist. And I think those two pieces go together really well in terms of helping people navigate their journey, as well as healing and thinking about intimacy, emotional, sexual, physical intimacy in their life. Usually when I come to the conferences, I talk specifically about intimacy. So this is really a new piece, being able to talk about healing from trauma today. And I'm excited to do that. I also just want to thank Jasmine specifically for inviting me, and appreciate so much seeing how her community has grown and the beautiful things she is doing to just empower so many, and I'm just really honored to be a part of that. So I would love it if there's any questions today. We have a small group, so just feel free to shout out a question, and I'll probably repeat it so that if there are people online. I don't think that there is any way to receive online questions, but no, okay. I did offer on the last slide, there's my website, and feel free to reach out to me in that way if there's questions I didn't answer today that I can. Let me just grab my clicker here. Okay, so when we're talking about medical trauma, I think it's really important just to define how that can happen. And I think there's so many different ways. The first thing I think about is when we don't have a diagnosis. So our body is experiencing something going wrong, some sort of pain, and we don't have something to call it. And therefore, we don't have treatment associated with it either. And I would call that a trauma. And the reason I would call it a trauma is because it sort of stops us in our tracks. When I think about trauma, just on a baseline, I think about the brain. And there's a difference between stress and trauma, right? Stress kind of makes us exhausted, it holds in our body, it causes anxiety, but trauma does something different. It sort of takes us in the hand model, we think of the brainstem, and how trauma sort of captures us right there in our most primitive brain, right? So we're just thinking about how to be able to breathe, digest our food, right? Just get through the moment. That's what trauma does to us. And when I think about somebody with illness and something going wrong with their body, and they're finally in front of a medical provider who they are thinking is going to be able to help them, and they don't get the diagnosis they need, and they don't receive the treatment, and they might not even receive the validation of what you're experiencing is real and scary and difficult, that sort of shuts down the system. And the person braces for, how do I keep going? I think another way that medical trauma can occur is when you're not communicated with respect, that you are not seen as an equal in a medical setting. And I think medical trauma may also occur when the very treatment we receive causes us harm, right? It may cause scarring, it may cause such severe side effects that we have almost a secondary illness to deal with. And then, of course, there are many that aren't able to access the level of care that they need. I have an autoimmune condition, and so I'm not living with HS. I'm living with lupus. And I think about when I walk into a medical setting, how my whole system sort of like scans the area, right? And I'm looking at the people in the waiting room and how they're doing. And I'm thinking about What am I going to say? And how are they going to listen to me? And will they believe me? And I think all of those are sort of like, they're what we would call hypervigilance that occurs within medical trauma. And so today what we're going to be talking about and thinking about is, if this resonates and if this is something that you're dealing with, what are the steps we can take to help to heal the body and to respond to it effectively? Okay. In working with the community too, I think it's important to think about trauma, and there's so many different definitions, but the definition I have here on the slide is an experience that overwhelms the system and disrupts your brain's ability to integrate information, resulting in a lack of flexibility, coherence, and adaptive functioning. That's a mouthful, but I just wanted to read that aloud so we can walk through it and think about what are the tools we can use to heal from it. I think in addition, when we're dealing with those sorts of things within our body, we're often also walking into a medical system that doesn't hear us and doesn't see us oftentimes. We are dealing with, here in the United States, a medical system that's deeply distrusted. And depending on which marginalized identities we hold, we experience that with a greater amount of fear, right? Will I be treated correctly? Will I be understood? Will I be listened to? And that systemic oppression, I think, builds layers on top of the trauma that already is HS. I think additionally, the lack of communication and information that we receive when you are in a medical setting, or on the reverse, if you're sitting with, for instance, a mental health specialist and they don't know what HS is. And so you are sitting there having to explain it to them. And oh, okay, is that how it works? And now you're doing that extra lifting and extra work. I think that's yet another layer on top of the trauma. And I've added the word grief to this because I think that grief has a big piece in trauma, right? If we deal with what's happening and what's scary and what's painful, we also are left with what didn't happen because trauma happened. And so I think when we're thinking about medical trauma, we also have to really acknowledge grief and how do we heal from grief and loss. So as we're walking through this, I just, for the next couple of slides, I wanted to give a case example. And I think, fortunately, unfortunately, a lot of people in the room may be able to identify with elements of this case study. This is somebody who symptoms began around puberty, around 11 years old, and I'll call this person Melanie. Initially, when her family took her for treatment, the doctors didn't know what HS was. So they associated it with hygiene. They associated it with a need for weight loss. A few years later in Melanie's story, some doctor even associated it with, an STI. And there was, as a result of the several years of misdiagnosis, there was also a lack of useful treatment. So when we think about going through those young years and all the things that should be happening, the positive things that should be happening in Melanie's life, right? All the developmental moments and hurdles to walking through that with an undiagnosed HS, there's also the isolation that starts to happen, right? I don't want to talk to my friends about this. They're not going to understand it. I don't even know what it is. So I'm going to kind of pull away. Probably, we could say some depression, probably some pretty high levels of anxiety. And what also goes along with that is the lack of opportunity for socialization, for connection with peers, for those experiences that come with that. Think about dating and confidence building around that. And so then also a layer of fear and anxiety that results from that that's just kind of chronic, right? And when we track that back, it's not just HS and the symptoms, it's the lack of diagnosis and treatment that really begin this long chain of events that I think looks like medical trauma. And don't worry, we're getting to that point where I'm going to suggest some ideas of what do we do with this, because it's not a good way to end a conference if I'm just here to give you bad news, right? That doesn't feel good on a Sunday when you've all been sitting here and engaging in this topic for quite some time. So I am getting to the good stuff here. I gave you that definition, that long mouthful of a definition of trauma. And one of the reasons as a therapist that, most of my days I work 8-9 hour days, and most of the time the folks that I'm working with have what we would call complex trauma. So that's not just an acute event, but chronic trauma they're dealing with. I don't want to make assumptions about my audience I'm speaking to, but if I had to guess, those of you surviving a chronic illness and also weathering through the storm of this world and managing families and partnerships and all the things, we could probably check the box for a lot of you on the idea of complex or chronic trauma. Some people don't like that term, right? It doesn't feel empowering. So I think I can also offer thinking about where you are in a healing journey, because that can often feel better to people, to think about this as more surviving and healing, and how the energy that takes to get through that. But when we're thinking about what it does to our system, oftentimes we're navigating our lives and we're trying to sort of work at 100% level. And our brain is really stuck in the basement. It's sort of, it's almost like frozen, right? Frozen in trauma. It's like something's happening to me and I'm not okay. And nobody understands this. And when we are frozen like that, we're not in our best place to make decisions, to navigate complicated social relationships, to communicate most effectively, but yet we're pushed to do that all the time by doctors, by family, by friends, by partners. And so I think it's really important to be able to begin to assess, where am I in this? Am I in sort of the basement of my brain where I'm just like holding on for dear life? Or am I able to use some of the tools I need to take some breaths and actually begin to have a little bit more flexibility in my own system? So when we think about that case study of Melanie, for instance, and we think about the lack of flexibility, so I'm not thinking about like the body moving. I'm thinking about flexibility in terms of our minds moving. So when we walked into this room, and we walked through that really fun entranceway and the silver, I don't know, it looked like I was walking into Wizard of Oz or something. I was kind of excited, right? As we walk into a space, flexibility allows us to say, this is kind of a cool place to be, and who do I want to sit by, and do I need something to drink? And it allows us to listen. It might allow us to multitask in today's world, so we can kind of like doodle on our phones and listen and do something else perhaps. But when we don't have the flexibility in our mind, we start to miss things, right? So the only thing our mind is paying attention to is our symptoms, and maybe hiding our symptoms or managing our symptoms, or we're starting to feel like nobody else gets it. Nobody else knows what I'm going through. So that lack of flexibility in Melanie's case resulted, after a few years, by the time I met her at 14, 15, it resulted in what was a very diagnosable mood disorder. She was very, very isolated, so she wasn't going to school. She was in an online school. And what I would call a limited expression, or masking. And I think the term masking often makes sense to folks who are surviving HS because it's what the world wants you to do, right? Like, I don't want to talk about this. It's overwhelming to know about this. So when you're at an event like this, it's like, okay, so finally I can be with people that can handle it. But a lot of times the world asks you to kind of put on a mask and not reveal your whole self. There's also, when we're in trauma, what we would call a lack of coherence. So for those of you that have ever maybe been in a flare and you're trying to manage some difficult emotional moments with a partner or a family member, and you're just realizing, I'm not communicating what I need, I'm not communicating very effectively, it's because of pain, yes, but it's also because of the layers of the trauma that causes you to sort of be in that frozen state. So poor decision making, a feeling of like, again, no one gets it, so a lack of support. And the adaptive functioning, when our brain isn't flexible, when we're not making coherent decisions, we actually have a difficulty with problem solving that affects medical adherence, treatment adherence. So for a lot of people, I hear the story of them saying, like, the doctors feel like I'm not trying hard enough. They think that I'm not doing what I need to do. And that's not because you don't care about your body, and it's not because you're not trying to get to your healthiest place you can be. It may be because your system is traumatized, and you can't really make sense of everything, and you're not feeling understood. So giving somebody a lecture about taking the medication or taking better care of themselves is not what fixes it, but helping to re-regulate the system so it's not in that frozen state, I would argue, is the better place that we need to be. And so that's what we're going to talk about for the duration. How do we heal this? So in therapy world, there's sort of two distinct approaches. There's what we call bottom up or top down. In bottom up, we're thinking more about somatic healing. So we center first on what's happening in the body, and we then help to heal and gain information so that we're able to eventually change how our mind is experiencing our body. The other way to go about that is top down. So we start with our thoughts, and we hope that that route will then connect to managing how our body is experiencing things. Both are valid, and I think some of it just depends on what your comfort level is and who you are as a person. For me, I'm more of a bottom-up person. So things that really work for folks are somatic experiencing, and let me just give you like a quick example of that. Okay, so I know that when I'm feeling pain, my body tends to tense more. So I'll notice that even though my pain is in the back of my neck and my shoulders, I'm sort of like crippling my body, right? I'm holding it in sort of a rigid way. And when maybe somebody goes to hug me or touches my back, I almost notice that I'm sort of like this. So in somatic healing, what I would do is center around that. So I would start to sort of open myself up. I would start to just notice how that's affecting me. I would see how I feel different when I change my posture. That's a really brief example of somatic experiencing. EMDR is another form that we use in therapy, which is using bilateral stimulation to sort of process trauma. And then we're going to use an example in just a moment of parts work. We also call that internal family systems, but parts work acknowledges and works with the fact that all of us are the multiplicity of the mind. So we all have different versions of ourselves that developed, that sort of protect around us and help us manage. Other forms, and some of the wonderful people who are out in the main area today are involved in other forms of healing like massage, energy work, mindfulness, and those would all fall under this bottom-up processing. When we think about top-down, that would be more things like cognitive behavioral therapy, communication strategies. We could also include parts work, and I think things that involve creativity, so expressive therapy. When I walk into this room, it doesn't look like your usual conference, right? It's way more colorful, it's way more exciting. And I think that makes sense. It makes sense for the person who's creating this conference, because creativity and expression is a healing opportunity. And so everything around us sort of like is witness to that. And we're gonna go through a couple examples of top-down and bottom-up. Any questions or comments that anyone has? Yeah.
If I know somebody with HS or whatever, and they live in a different state than I do, so how will we find the right provider so we don't go 5 years of undiagnosed stuff going on or whatever, so we can get right to where we need to go? Are we going online or something like that to find that provider that deals with HS?
Yeah, so I'm going to summarize the question just for the online folks. And the question is, how do we find the right provider so misdiagnosis does not go on for a long amount of time? I'm thinking that our world is so much better for that than it was even 5 years ago. Because now I think people are relying on social media so much. So I think even if you tag in the symptoms, right, in social media or even a Google search, you're going to pop up with things like HS Connect. And when that's happening, they are going to be, rather than the bureaucracy giving you the information, it's the actual people who are surviving there saying, here's what works, here's the person to go to. I think then what I see people doing is also sharing with each other in community what are specific treatments that are working. And so then you're able to add to sort of your search or your search for your family member in thinking about even the things, so I heard this speaker and she was talking about this EMDR thing and I have no idea what that is, but like, hey, let's Google that. Let's figure out who's a provider for that. Not to put you on the spot, but you were kind of nodding, yeah. So would you want to add anything to what I'm saying in terms of?
I think what you said was perfect. HS Connect, there's a group of us, I've been an advocate with them for a long time too. I found a lot of really helpful information through all the advocates on HS Connect and Austin as well. So those are two big things where you can really get the information you need. And if you go to a doctor and you don't feel right, find another one, because too many people don't. They just think that's what they get. You gotta find something that works.
So is it like a special doctor that just deals with that? Because I know everybody don't deal with that. So we don't want to, like I say, spend a lot of time running around chasing doctors. We want to get right to the point so we can get the stuff dealt with or whatever.
Yeah, so just to summarize one of the things that was said through the audience, for our online audience, is a really important piece of advice is don't stay with somebody who is not hearing you and listening to you and giving you the information you need. There is somebody else out there, and so dump them and go to someone else. I also think that, at least in my experience as a provider, the way that I found the community that's helping HS is through the dermatological community. So they were like my point of contact for understanding what HS was. That does not mean that every dermatologist understands HS. And so I think that the biggest piece of advice I would have is, if you have a friend or a family member and they have HS or they have symptoms of HS, I would interview that doctor before you even get into any sort of exam.
Say this is already your primary doctor. So what you would tell them is like, well, look, I looked this up and it feels like, well, it looks like this. Now, can you connect me to somebody else? Now, you may not know, but can you connect me to somebody else?
That's right. And so what do you do when you work with a doctor already is the question, and like they are your PCP. I would say to that doctor, these are the symptoms I'm having, this is the information I'm finding about it. Do you know that term? Can you connect me? And where have you found the starting point? And if you're getting nothing from that doctor, I wouldn't spend much time, right? I would keep it moving. And also, I think in our world today, at our larger health systems, such as in Detroit, we have the Henry Ford health system, right, that I connected with for HS. And so it's pretty easy once you're working within that system to see who is a specialist, right, for that. So,
You have questions of him before.
yes, yeah.
And if I could add real quick, on hsconnect.org, there's lists of dermatologists who specialize in HS. So you can find somebody right there.
And just another shout out from the audience on HS Connect. So thank you for helping each other too. I appreciate it so much. Any other questions before I continue? Because I'm going to put everyone to work. Don't worry, it's not something we have to like get up and move around and talk a lot. I just want to give you a chance to sort of try out and see what you like better in terms of addressing trauma. So if you are somebody who is a family member or a friend or an ally, I think this can still work for you, is my hope. So what I'm going to ask us to do, I'm going to give us 2 different routes to healing to try out. And I find that when I'm doing something like this, it helps me to center myself by closing my eyes. And a lot of people don't feel safe or comfortable to do that. So if you don't feel like closing your eyes, or you think it's Sunday and I just ate lunch and I'll probably fall asleep and start snoring, you can just center your eyes on sort of like a spot in the room or the floor in front of you. And that's just another way to center and to focus. So I'm the first presenter I heard to use the chair here. So the first example I'm going to give us is a top-down strategy, okay? So I'd ask you just to focus your eyes on something in the room or to close your eyes. It's really your choice. And I'd like you to consider an event fairly recent, last year or so if you can, that you experienced avoidance or embarrassment, or even shame related to HS. If you're somebody who's an ally here, you could just try out this exercise and leave out the piece about HS, right? Just thinking about avoidance, embarrassment, or shame. So I want you to hold that hard memory for a moment. And in your mind, if you can label that with a specific word or phrase. So, in my case example, Melanie would have said, dumb girl. Other people might feel like tired, sick, pain. Label it with a word, your experience. And next, we have our memory and our word, and I'd like you to connect it with the root. So the root of most trauma is usually about a lack of safety, a lack of control, or a feeling of responsibility. And what I mean by that is, it's all my fault. I did it wrong. So connect it with a root. Which is it for you in this memory? Is it about safety or control or responsibility? Just hold that for a moment. So the negative thought in your head is probably like, I am fill in the blank, right? I am not safe. I am out of control. I'm making bad decisions. What is the thought associated with this memory? And now I want you to take and change it. So I want you to think about HS and how in the future you want to imagine a moment like this going. So Let's think about empowerment. Let's think about the idea of speaking up for yourself, of not holding that shame within yourself. So I want you to imagine a future experience, and I want you to change that I am. I am wise. I am informed. I'm in charge of my own life. I'm worthy of treatment. I'm worthy of support. Whatever that mantra is, I want you to hold the image in your head of feeling empowered, not letting yourself be blamed, and then connecting it with your positive mantra. Okay. So that's a top-down strategy. Keep yourself centered for just a moment, and we're going to approach it from a different way. So this one's a hard one, but you might like it better. So let's just try it, okay? I want you now to focus on an area of your body that's holding pain or discomfort. Anywhere in your body. It could be related to HS, or it could be related to, a muscle ache or a headache. See if you can just center your mind around that right now. And as you're picturing that, I want you to imagine that there is a part of you that works almost constantly round the clock to take care of this pain, to protect it, to heal it, to hide it, to advocate for it. What do you call this part? What do you know about this part of you? As you picture this just not as pain, but a part of you that's taking care of and holding the pain, you can imagine and ask it questions. Is this part scared or vulnerable or tired? Is it trying to distract with laughter or humor to make other people comfortable? Can you look at this part of you right now and offer it compassion? Can you let this overworked part know that you see them? You see this part of you having to take care of all the pain. And could you ask this protector part, how would it rather help you? Are there things it would rather do to help you on this journey than what it's doing right now? Okay. So let's just take a little deep breath now. And that second part was a bottom-up exercise. So we started with the body and we moved into our thought process. I'm wondering if anyone noticed a preference or difficulty associated with one example or the other. Anything anyone would like to share? Yeah.
I had to start with the mind first. For some reason, for me personally, it is anchored there. So although I tried really hard to get in the mode with the bottom-up approach, my mind was like,
lean in.
Yeah, so great comment about just realizing what comes naturally to you and being able to flow with that, because some of us just naturally can talk more to our, our thoughts. And I think for a lot of people that feel chronic pain, being in touch with the body can be really, really difficult. And there's a part of you that kind of pushes away. And so I think that listening to that is so, so important. Thank you for sharing. Yeah. Anybody else? Okay. So I just wanted to give us a little bit of a teaser in thinking about and getting in touch with. I think we talk a lot about how to heal the body, but when we're healing the body, we have to pay a lot of attention to our mind and our spirit. And if we work one and not the other, we really can only get about 25% of the way. And so what we're talking about here is how do we begin to lift some of that burden that we're carrying that's related to the medical trauma that you're carrying. So I wanted to give a nod in this slide to Judith Herman. Judith Herman was one of the first trauma researchers going back to the 1980s. And she did a lot of work around collective trauma that I think is very applicable to our conversation today. And one of the things that she thinks about is sort of this like 3-tier approach. So those of you that are familiar with like the stages of grief, similar to the stages of grief where it's not like you just rotate through them and then you're done. Like that'd be really cool if it was, but those of us that have experienced a hard loss, right, we know that you sometimes go through those stages multiple times. And the same would be true for these stages. You often go through them more than one time. But what's important is we don't get to fast track to, say, reconnecting and integration if we're not in a place of safety and stabilizing. So safety and stabilizing is primary, and I think what's really important about that is we have to advocate to have the space to do that in our life. So how do we do safety and stabilization? We do that by building our support system, learning how to take breaks and lean out when our bodies are in pain, learning to tell our story. And that kind of moves us into this idea of remembrance and mourning. What have you been through that you have not spoken aloud? What is your narrative about what you have survived that maybe is just held within you but not spoken about? And finally, like, how do we begin to reconnect, right? This weekend is about reconnecting our wisdom and our story to a larger community. And one of the findings that Judith Herman had is without that reconnection and integration, people aren't really able to fully heal from trauma. So I think this is very important for me when I think about other people's work or my own work is, do I have roots? That's how I think about it. Like, are my roots planted so that I can begin the work of thinking about my story and thinking about my survival and thinking about what I've been through and speaking to that? Or am I in a place where I really need to focus on that frozen part of my brain that doesn't feel safe? And, going back to the question about finding a provider, for a lot of people, I think that can be about finding the space of therapy. For other people, it's finding community, right? Even in an online community that can begin to stabilize them. Moving on to how we use this to advocate for ourselves in the work. In the theme of trauma and healing, we need to be able to begin to name and identify triggers. And I think we want to do that in a way that's not just sort of stopping people, like I'm triggered, I can't do anything. But let's imagine that we are in a medical appointment and the treatment that was really hopeful doesn't seem to be working. And the doctor's really excited to tell you about the next thing that you can approach that might be better, and we can try this. And what you notice is your brain just stopped working, right? All you hear is like Charlie Brown, wah, 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 right? Like nothing's happening. You have a right and need to begin to advocate by saying, I can't do this right now. Like, I can't make sense of what you're talking about. This is overwhelming to my system. So I'm just noticing I'm not online. And that's another term that I think is really helpful to me is like, I'm offline right now. Like, it's just not, I can't digest it. I think we should also be able to do that in our relationships. If people know what you're holding, they should also be able to hear from you, I can't right now. My brain isn't safe right now. I'm trying to gather myself and root myself to stability. I can't hear you right now. Because if you push yourself through that moment and try to do that for whoever else needs you to do that, you will not be good to yourself, and you probably won't be able to give them what they want from you in the first place. That doctor wants you to listen and take notes and go home and leave the appointment and do the things, and you're not going to be able to because you don't feel safe in that moment. You feel triggered. So I think self-advocacy is about recognizing that as a natural reaction of our body. Your body's grabbing hold of you and being like, you can't right now, we can't. Listen to it. Have responsible expectations, reasonable expectations for yourself. Anyone here heard of spoon theory? Okay, a couple people. Spoon theory was somebody who has an autoimmune condition, was having one of those frustrating conversations with a friend at like a Coney Island, or I guess what do you call Coney Islands when you're not around here, like a diner. And so was trying to explain when you only have 5 spoons, if you are living with a chronic illness, sometimes getting out of bed used up 2 spoons. And for her friend, when she explained this, she was like, that didn't use up your spoons. Spoons are energy. Spoons are what you use to get through the day. And what we need to think about when we're managing a chronic illness is it takes us more spoons to live. So if you're starting to look at your day and think, well, I got 5 in front of me, and I want to get to that conference today because I really want to see this friend that is at the conference, that might mean that that other person that wants to sit on the phone and tell you about their problems this morning while you're drinking coffee, you're going to have to shut that down because you don't have the energy for that. You are not a magician, and you cannot have the energy for all the things. So spoon theory says account for that and use your spoons for you also. It also leads us to have goals for our social encounters, for our relationships, and even thinking about our medical appointments. What do I want to get out of this? What do I need to get out of it? So I walk into that room and I advocate for myself. Here's the question I really need answered today. Or walking into a relationship with a friend. I have a friend that as soon as she calls you, you know she's going to launch into like 10 minutes of just the update, right? And I might say to her, I love you. I'm excited to here's something I need from you right off the top. I need to tell you about my recent appointment. I want us to make space for that. And that's having reasonable expectations of my friends and my relationships, building in room for me. Also, pacing and breaks. So if we listen to our body, it is telling us messages. We learn to hate pain, and that's understandable, but the pain also says something. It says slow down, it says stop, it says breathe, it says get water. It says a lot of things. If we listen to it, it will guide us, but we have to respect it and listen to it. And then finally, we need to make space for grief. So if I can just read this brief part, in the space of trauma, in what did not occur because of what did occur. So medical neglect, misdiagnosis, lack of sensitivity or compassion in the space of trauma, There are the experiences, the moments, the opportunities, the missed choices we didn't make, the people we didn't date, the places we failed to go. That is grief. In the space of trauma, there are the ways we failed ourselves because our bodies and minds are overwhelmed and dysregulated. The ways we failed to listen to our body, the care we didn't give our body, the ways we couldn't advocate. That is the buddy of trauma, is grief. And so when we're thinking about finding forgiveness for ourselves and acknowledging the grief, I think there are a lot of different skills that we can use on our own as well as in conjunction with others. We did a really brief exercise here about the idea of like this protector part in us that's taking care of our pain. So using that to begin to work on your own internal communication. Try not to hate that part. Try not to be angry at that part. Try to learn from that part. Actually having a conversation with the part in you that's holding all the pain. Thinking about HS as something separate from you can be also very useful for people. So when you start to talk about it like something that entered into your life versus something that is you, you'll start to begin to have some distance that's actually helpful from it. And then finally, there's the stressor and there's the stress, right? And the stressor is HS and a lot of other things that we sometimes don't have choice about, but we need to manage and work ourselves through managing stress that's the result of the stressor. And how the 5 primary ways we do that are through rest, and it doesn't include a 30-minute nap. It has to be like real rest. Affection and connection. Creating. So many creatives in this community that are making jewelry and sharing stories and just amazing things. And that creating is actually helping to move through stress. Imagination and fantasy. Here's an interesting tip about stress, is that if you fantasize about something, like let's say you have a horrible doctor's appointment and you really just want to kick the doctor on the way out because they didn't understand you at all, it's actually not bad for you to fantasize about kicking the doctor. You should not actually do it probably, but it's actually helpful to manage the stress to do that. Violence is not wrong in our fantasies, it turns out. And then finally, movement. So stretching our body, just sometimes really quick, and I know I'm out of time, but my mom has a watch that she, that tells her, you know, her Apple Watch that tells her to stand up. And every time she gets the note, she curses it. Every time. She's 80, and so she'll be like, that damn watch told me again I gotta stand up, and then she won't stand up. So don't do it like my mom. Stand up every once in a while, right? Like, take a stretch, listen to what that part needs, and just try it out. But movement is really another great way to manage stress. And managing stress helps us make room for grief, because if we don't touch trauma and grief, they look bigger than they are. So I think being able to look at it and touch it will make it more manageable. So I'm going to pause there and see if we have any comments or questions at all. Yeah.
I guess maybe I'd ask, you know you have trauma. Everybody in this room probably has something.
Agree.
What's the first place you start? Where should we begin?
Where should we begin? So I think where we begin is first acknowledging it, right? People don't like the word trauma. If you want to make up a new word for trauma, go for it. But I think we need to start with recognizing that this journey I am on has brought trauma into my life. And I think the second part is being able to ground ourselves. Because if we're not stabilized, we're not in a place to begin processing. And when we think about processing, we're really trying to hang on to the story of trauma. So to stabilize is to create a structure around us, around our body, around our support system that allows us to breathe. And I think then just training our body to touch in and touch out. So the first way to see if you're ready is just to have a little image of the trauma, like we did today, right? Can you look at it? Can you look at a story that you hold of maybe the beginning of HS when you first realized it? Can you glance at that in your mind's eye and move yourself back out of it? That's where I would start. And not staying in it too long, right? Just staying in it for a moment. That's a place I'd start. And if you notice, I feel short of breath, I feel sweaty, I feel sick to my stomach, that's because it's so intense, right? And you've locked it away so much. So then stabilizing is learning how to breathe. It's learning how to have a safe image and go to it. Those are the things that stabilize. Thanks for your question. Yeah. Anybody else? Yeah. Great question. So is there a timeline on trauma is the question. Bad stuff happens to us, and not all of it is a trauma. So we know it's a trauma when it's kind of causing us to freeze, and it's keeping us from moving forward in some way. So I think, let's say it happened a year ago, 5 years ago, 10 years ago. The best way to understand is there still more work to do is to glance at it, just like I kind of just referenced. And when I say glance at it, just put in your head an image or a word associated with that hard event. Maybe it's not a trauma, it's a hard event maybe. Glance at it. See if you can feel it anywhere and see what happens in your head. Do you get a negative thought about it? Like, I'm so stupid, I failed at that. Or do you get a bad feeling in your stomach? And then again, moving in and out, right? That's a lot of, I probably wouldn't have a job very long if I stood here another like 30 minutes because I'm gonna give you all the little tricks, right? But that's what we're doing in therapy is we're helping you take a peek at it and move out of it. And I think that every person in this world, but especially in this room, deserves a chance to just check out the memory. What you're saying is such a great question, right? Because like maybe it's over, get over it. If it's time to get over it, your body's gonna come up with like, yeah, that's boring, nothing there. Okay, cool. Great, we're past it, we're surviving and we're moving on. But if something's there and you're still feeling something, it deserves more time to process. Is that, okay, it's a brilliant question. Yeah. Yeah.
So there was a part of your presentation where you talked about how if someone is still in that frozen state, they will actually avoid the treatment that can
Yeah.
help them to heal. How do you encourage someone to take steps that will actually help them when they want to avoid the treatment, but they also want the healing?
Yeah, so wonderful question from the audience about how when somebody is in a frozen state, do we help them to grab a hold of the treatment? They want to heal, but they can't. When I work with medical doctors, we talk about this quite a bit because medical doctors, honestly, they don't have the space to help people oftentimes when they're in that frozen place. What they notice is, you're not doing the things. Like, you're not joining me in this treatment I want to give you, maybe. And so I think that's the place that doctors need to coordinate with somebody else that connects with that mind-body element. That might be a therapist, that could be somebody in massage. It doesn't have to be a therapist, but if you are a friend, for instance, of somebody, and that person you're noticing is just like, heels in, I would begin to ask them, what doesn't feel in your control or in your safety or do you feel responsible for? And I put that on one of the slides, and the reason I do is those are the core components of trauma. And so if we begin to help someone acknowledge, it's not because you think the nurse that came into the room is an idiot. Maybe the nurse is an idiot and you don't like how they talk to you. Or maybe the side effects look too scary. Those are real things, but let's begin to label them as what they are in their root, right? And the root is about safety, a lack of control, or a feeling of like excess responsibility. And I would begin there. Another thing that I think is really important is to begin to listen to what we're sensing when we walk into spaces that are around treatment. So for instance, if I'm walking into my rheumatologist, I have this part of me that gets an attitude like right away, right? Where I'm like, yeah, I'll probably have to wait a long time, you know, and then I'm like, oh yeah, and they're gonna want to talk to me about my blood pressure, and that's what, like, I notice that, and I think, what am I reading that makes me not feel safe here? And it's I start to name the things, because those are things in the context. If I can start to name them for my system, they start to make more sense. And when we name it, we get out of the frozen. I don't know if.
That's great.
Okay, thank you. Yeah.
Hi, Erin. Thanks. Great talk, as always. Just, I have two questions. One is kind of building on the preceding question about the timing, but also like multiple traumas, say in your personal life and with your medical trauma. How do you approach it? Do you approach that as a single unit of trauma, or is it like, do you dissect each thing separately, or how would one do that? And then my second question is, just related to this lady's question is, some people go into the frozen state, come out of it, and are perfectly normal, and then like kind of like an up and down. And is there a way to help to stabilize that?
Okay, beautiful questions. So the first one, what we've learned about trauma is that there are channels. So sometimes when you think, I'm going to think about and begin to process the first flare I ever had, or the moment I discovered HS, or the time I told my partner that that I was dating about HS. You think you're addressing that, and then all of a sudden, divorce comes up, and you're like, well, what the heck? I wasn't trying to think about divorce. They are held together by a core belief and a feeling in your body. That's what holds trauma together. So don't get caught up in the semantics of which is the trauma. Focus on the belief system and the feeling in your body associated with all those memories, because they have like a thread. And so I think that's the best way to think about that. I know that sounds maybe a little complicated, but like they're tied together, so let them be, I think, is what I'm saying. And then your second question was about this.
Yeah, kind of being frozen, being frozen.
Yeah. I think that, and I know I'm about to get kicked out of this room because it went over, but when we think about this idea about healing trauma, we go through these phases just as you're speaking about, and something can throw us back into frozen or a lack of safety that's happening in treatment or our support system, losing somebody. So we have to be able then to move back to what is like baseline. So if you all can figure out, how do I take care of the roots or my baseline, you always go back to that and what worked for you then. And then you move into the processing of what is a new thing that's triggered you to go like this. But I think this slide feels really important to me, because these are sort of the up and down of it, and we're all going through that if we're processing trauma again and again and again. So my thought is, too, I've given you some tools to get in touch with some of the trauma, but also really thinking, I think part 2 of this would be, how do we help to figure out your baseline of safety and stability. What gives you that? Okay, I know there's some rumbling in the back of the room because I think there's another speaker, but I will stick around in the back if anyone has any individual questions or comments. I really appreciate all your energy and your great questions today, and thank you for being here. And good luck in your journeys.